All right, I think it's time to start. It's about 3 minutes after 6, and welcome everyone. Alrighty, Amber and Lalji, are you all? For coming to this session of What's Up Doc. My name is Michiko Masloom, and I'm the Program Director with the Fraser Northwest Division of Family Practice. Our organization is proud to host this new community education series with the assistance of some fantastic physicians whose knowledge and expertise are the driving factor behind making these sessions possible, as well as our community partners and organizations who endorse our various topics of presentation and provide support where they can. Before we begin, I just wanted to give some gratitude and recognize the traditional lands of the Coquitlam, Coast Salish, Kikite, Musqueam, Tsleil-Waututh peoples, where we all have the opportunity to work, live, and play on. Just a couple of housekeeping things for everyone. You will notice that there's a link to Slido, and the code is for the session. It's right here on your screen. So if you take your phone put the photo app to that QR code, you'll be able to get to Slido. For tonight, any questions will be submitted through this, but feel free also to use the chat feature in Zoom as well. With Slido, you can use a phone, computer, or your tablet, and we'll be keeping track of all the questions, and we'll be able to give Dr. Halai and Dr. Jarvie those questions at the end. So for the agenda, we're going to start off with a presentation about long-term care, and this is hosted by Dr. Amber Jarvie and Dr. Lalji Halai. And then afterwards, we'll have our Q&A session via Slido or chat. So I'm excited to hand things over to tonight's speakers. So Dr. Jarvie and Dr. Halai, they're some of our family physicians in the community, medical directors at some of our long-term care facilities, hospitalists in the community, and as well, there are physician leads for the long-term care initiative. So thank you, everyone, and I'll pass it over.
Okay, so I'll start off. My name is Dr. Halai, and I do work, as you saw the previous slide, in long-term care. So just to talk about what long-term care is, and I mean, it goes by several names, and it used to be called extended care. Nursing home is the usual term referred to it, geriatric care facility, and continuing care facilities. It used to be non-residential care homes, but that term has changed to long-term care now. And it's mostly for people who have complex and unpredictable medical and non-medical needs, who, I mean, could they've been at home either or in assisted living or independent living, but they can't continue doing that in a safe manner. Then they would need a higher level of care, and that would be long-term care. And the services provided in long-term care are basically personal care services, meaning services where you need bathing, you need other activities of daily living, so to say. Those services are provided along with, of course, medical and physical needs. And this is services which are required 24 hours a day, so around the clock. And there is nursing care and personal care as well, and the therapeutic and support services as well. Moving on. So we have a video, and I'll let Alana talk to that.
Deciding to move Mom into the home was definitely difficult, probably one of the toughest things I've done. I'd always envisioned taking care of her at home, and the thought that that wasn't going to happen was a very difficult adjustment to make.
Hi, I'm Nick Petropoulos, family doctor in New Westminster. We recognize that moving to a care home is one of the most stressful decisions you and your family can make. The choice can feel even more urgent if you've experienced a health crisis and wonder, am I safe at home? You may be surprised to find that the answer is often, yes, I can be safe at home. With the right supports, living at home may continue to be your best option. However, if you find you are struggling with your physical health and activities of daily living, then moving into a care home might be right for you. You may be eligible for a care home if you are supported by Fraser Health Home Support. They are providing the maximum medical and personal care possible in your home. And your care needs have become too unpredictable or too much to live independently. Speak with your home health nurse about what is best for your situation. They will support you to remain in your home as long as the benefits outweigh the risks. And when the time is right, your nurse can assess if you are eligible for a care home.
I have to say that the move-in was actually a very pleasant surprise. She never complained of loneliness anymore. She used to say, they keep me busy here, and that's a real plus in my books.
Find more answers to you and your family's questions about long-term care at fraserhealth.ca/seniors.
So I've seen on Slido there were a few questions already about care homes, and the local care homes we have in Fraser Northwest, they're privately funded and publicly funded care homes. In Fraser Northwest, that's Tri-Cities and New West, we have 1,722 beds, 15 long-term care facilities, and it's a mix of both private and publicly funded. Moving on to the next slide. So here's a list of the care homes and the names in Coquitlam. They're all this, as you can see, Belvedere, Cartier, Dufferin, Foyer, Millard, and Lakeshore and the Madison. New West has 5, as you can see from the list: Buchanan, Kiwanis, Queen's Park, Royal City, and William Rudd. Port Coquitlam has 3, Hawthorne, Nicola, and Shaughnessy, and Port Moody, Eagle Ridge Manor, 1. Just another video to show you about care homes.
We often hear the question, why can't I go to the care home I want? At Fraser Health, we work hard to offer you care in your desired care home. However, it's important for you to know that each care home is designed to provide specific types of care, and we can only offer you care in a home that meets your care needs. Choosing a care home starts with you choosing which communities you would like to live in. Fraser Health will then provide you a list of homes that meet your care needs in those communities. You will then choose up to 3 homes called your preferred care homes. If there's no availability in your preferred care homes, you may choose to move into an interim care home in a community of your choice. Or you can choose to remain at home with support or move to a private care home. Regardless of your choice, you will continue to be on the wait list until your preferred care home is available.
When I first came here, I was a little scared. And I said, oh, I don't know. When I got here, I just loved it. I said, this is for me.
Find more answers to you and your family's questions about long-term care at fraserhealth.ca/seniors.
The last care home looked like a spa where there's so much saloon and personal care provided. Well, there is all the services in most of the long-term care homes, if not all. So what is it like to live in a long-term care facility or care home? So residents who require increased supports for activities of daily living, as I mentioned, bathing, dressing, toileting, eating, and mobilizing. So the nurses are there to support with the residents and their medications. And in terms of mobilizing, there's also rehab and physiotherapy and occupational therapy services available. So that can be helpful as well. Again, another video just to look at.
To have so many friendly people here. You wouldn't believe it. And at nighttime, when you get out of bed, there's somebody here to see you're okay.
A care home is your new home in a community environment with adults of similar abilities and care needs. Families often ask, what does a care home actually provide? We provide a safe environment for assistance with personal care, nutritious meals, recreation programs, and 24-hour nursing supervision. It's also important to know what a care home isn't. We don't provide 24-hour one-to-one care. We are not a hospital with daily medical rounds, and we are not a rehabilitation facility to regain walking and strength.
So when I come here, I start eating, and I just loved it.
Find more answers to you and your family's questions about long-term care at fraserhealth.ca/seniors.
So who works in a long-term care home? So the care home can be made up of multiple different staff members. A typical care team would include care aides who provide the daily personal care, a combination of LPN and RN nursing staff, a recreation staff, which may include a recreation manager and recreation support workers, a physiotherapist, and usually a rehabilitation assistant to help with exercises to try to maintain strength and mobility, a dietitian, care managers, and directors of care. Some sites may also have occupational therapy, spiritual care, and social work. And all the sites do have physicians in our area who attend regularly. So who lives in long-term care? Most of our long-term care residents are seniors who are living with dementia and have cognitive decline. About 80% of our residents live with moderate to advanced dementia. We also have persons with significant mobility decline for various reasons that are unable to move around in a apartment or a house on their own. Some may have had a stroke. Some may have had multiple medical conditions that have led to an inability to walk, or multiple other factors. Next slide, please. The average length of stay. So residents coming into long-term care tend to present, they're quite frail. So frail means they just have multiple medical conditions, and their conditions can change quite quickly. So they tend to come and live with us at the end of their life. Currently, the average length of stay in long-term care in Fraser Health is approximately 18 months. But that really varies depending on what the person's underlying medical conditions are. Ultimately, it's determined by home health and the acute care hospital team that it's appropriate to move to long-term care when someone can no longer be safely cared for in the community. So the physician care model is something that has changed in the last 5 to 6 years in BC as the divisions of family practice created the long-term care initiative. So in Fraser Northwest, which is our division that consists of the Tri-Cities, Port Coquitlam, Port Moody, Coquitlam, Anmore, Belcarra, and New Westminster, there are multiple physicians that work at every long-term care site. These physicians are family doctors who have an interest in seniors care. The physicians are typically on site every 1 to 2 weeks. So the model is to think of similar to how often you would see your family doctor in the community, but the family doctor is coming to you, and it's a little bit more often than we would typically see in a community. They will see the residents if there's any sort of change in their status or any new concerns, and then they will proactively see their patients at a minimum of every 3 months. Usually it is like maybe closer to about every month, but at least every 3 months. The physicians will also participate in care conferences, which is an annual review with the care team and the residents' loved ones, family or friends, and then medication reviews that are done between the nurses, the physicians, and the pharmacist twice a year. There is also 24-hour, 7-day-a-week physician coverage. So if any concern arises, that there's always a physician who may be contacted.
My mom's health was declining when she moved into the care home. She had had a couple of falls around Christmas last year. At that point, she stopped walking, and we knew that she needed a higher level of care, and as a result, we moved her here.
We find that many adults and their families don't have a full understanding of their illnesses, and they don't know what to expect as their condition declines. It's important to understand that most adults move into a care home because their health has declined and is likely to continue to worsen. We hope you will continue to live well, yet it's likely you may be as strong as you will ever be. Care homes are almost always the last stop on someone's health journey. This usually means that people living in care homes are at the point in life that they have many months to live, no longer many years. We encourage you to talk with your care team about where your health is at and where it is going as early as possible. Early conversations about your healthcare preferences help to honor your wishes as your health changes.
So the care team helped me sort out what my mother's needs are going to be. Even though it was a scary experience, we just all want to be prepared. My mom has had a good life, and we just want to make the best of what we can with what's left.
Find more answers to you and your family's questions about long-term care at fraserhealth.ca/seniors.
So what is the approach to care in a long-term care site? It is important to emphasize that long-term care facilities will have a different care plan that is individualized for each person that is there. The care focus is most often on the quality of life and maintaining the current function. And this looks different for everybody, but the majority of residents then will pass away at the care home, and the care home team is specialized in providing end-of-life care. Long-term care, as was mentioned in one of the videos, so it's not a rehabilitation center and it's not a hospital setting. So physicians do work more as they would in a community rather than a daily hospital setting. And in terms of rehabilitation centers, sometimes we do get questions about trying to, someone who is no longer able to walk, the goal is to get them to a walk again for family. But really at that stage, when people are coming to us, it's because it's felt that that those goals are likely, unfortunately, not achievable. And so really our goal of physiotherapy is trying to maintain the strength that we have, maintaining good range of motion of our joints so that we remain, in as little pain as possible, pain-free, and to be able to continue to move around as best we can. Another big initiative that you'll hear about in long-term care is polypharmacy reduction. Polypharmacy is taking too many medications. And we know that when people take multiple medications, it's a risk factor for very serious events for seniors specifically, but especially for the frail elderly population who are in the last few years of their lives. With each medication taken, there's an increased risk of confusion, fall, and side effects. So there are numerous initiatives within Fraser Health to try to reduce any unnecessary medications that are not providing the resident with comfort or quality of life. And oftentimes we see, especially as people have more hospitalizations or more illnesses do develop, they can come in on over 20 medications. So we do try to look at what is really providing them comfort and helping them improve their quality of life and try to reduce any unnecessary medications. Medication changes would always be discussed with the primary substitute decision maker or family before changes are made. But just important to know that this is a common approach in long-term care, and it is patient-centered, where we're looking at what that person's goals for their care are. So I did allude to the long-term care initiative already, and this is run by family physicians under the Division of Family Practice in Fraser Northwest. It was launched in 2015 and has ensured that Fraser Northwest patients in long-term care facilities have a dedicated family doctor. The Fraser Northwest long-term care community has coordinated efforts to support physicians to optimizing care for their patients in long-term care through implementing these 5 best practices. So the physicians working through the long-term care initiative will all participate in the care conferences. We'll do a proactive visit to each resident at a minimum of every 3 months. But like I mentioned previously, it's often much shorter duration than that. They participate in meaningful medication reviews twice a year. They will have completed documentation, including goals of care, documentation in the chart in terms of visits and discussions with family, along with documenting medication reviews and care conferences. And then the physicians participate in on-call support networks. So there is always a physician available to the site and for each resident if a change occurs in their status. Fraser Health has quite a number of resources for seniors, and they've compiled these resources, like they mentioned in the videos numerous times, about long-term care, advanced care planning, age-related hearing loss, assisted living, dementia and Alzheimer's disease, financial and legal matters for seniors, and the Family Guide to Services for Seniors within Fraser Health. And here are just a few numbers that also can be very helpful for seniors, especially with increased frailty and medical conditions, just general health information, home health contact numbers, mental health contact numbers, and some community services. Well, thank you so much for attending our talk. We are very available to answer any questions if anyone has any questions.
Great. All righty. So if you do have any questions, feel free to put them in the chat or also on our slido.com. And so I see that there are some questions up right now. So I will go through them. And then Alana, if you can put any of the ones in the chat in our Slido, that would be super. So all righty. So the first question is, are private long-term care homes worth the additional cost?
So private long-term care homes, if it is a long-term care designation, it will provide the same care as a funded bed in long-term care. Typically, I would see a client choose a private long-term care bed if they either are waiting for a funded long-term care bed, but the family is struggling to manage their care needs at home. They may go into a private bed in the interim, or if they are looking for a very specific location. But in terms of what is provided, it is the same between the two.
The next question is, I guess, what are the major differences between assisted living and long-term care?
Yeah, so they're very, very different populations. In long-term care, it's felt that at that stage that the patient does need 24-hour nursing support availability, and oftentimes there's significant needs for support with their daily activities of living. So that is walking, getting dressed, going to the bathroom, eating, and so oftentimes the vast majority of people are no longer walking on their own or are unable to transfer safely on their own. There are a few tenants or residents in long-term care that are able to walk, but they still need quite a bit of direction in their day-to-day in terms of getting dressed or having supports with using the toilet or transferring safely. Like I also mentioned, about 80% of people in long-term care are living with moderate to advanced dementia and often have challenges with decision-making at that stage in their illness and needs more support around that. In assisted living, they do have their own suite. Often they would go to a central room for meals, and they will have 2 care needs within Fraser Health. So the care needs could be that the nurse would provide medications and the care team may support them with bathing. So they need to have at least 2 care needs to go into assisted living, but they must be able to make their own medical decisions. So oftentimes maybe earlier stages of dementia or have no dementia, but other multiple medical conditions. And they do need to be able to mobilize and transfer on their own. So it does tend to be quite a different population.
All right. The next question is, there's the huge number of vacancies in the LTC in the Lower Mainland cuts the profit margin for private long-term care residents. So probably clients would suffer from poor service. How do we get private LTC homes out of the province? I don't know if that's a question that we're able to answer, unfortunately. Our focus is more on the physician aspect of care. Okay, thank you. The next question is, what are some examples of extra costs in long-term care?
So it depends on the facility. So extra costs could include, most of the facilities would have a hairdresser that comes on site, and that would be an extra cost, or a dentist that comes on site. Some have an optometrist who comes on site. Oftentimes there's foot care nurses that will come, and that often is an additional cost. At some sites, you may see occupational therapy as an extra cost if they don't have an in-house occupational therapist. Lalji, do you have any other examples that you can think of for extra costs?
Not really. You've mentioned most of them.
Yeah, perfect.
Yeah, if there are any forms to be filled, that could be extra cost. Yeah. But apart from that, I don't think of anything else.
And any personal items. So sometimes adaptive clothing. So if people are wheelchair bound or perhaps have had a stroke and have some difficulties getting dressed, there's specific clothing that can be more easily put on and taken off by staff. So little things like that, that would all be communicated by the care team.
Thank you. The next question is your family currently allowed to visit you now with COVID protocols?
I could start with that. So yes, families are allowed to visit. As you might have heard, during the pandemic March last year, they weren't allowed unless it was an essential visitor, meaning if someone was gravely ill or passing away. But now the restrictions have reduced, though of course there is screening when you come in. Everyone gets screened, everyone gets asked the questions, and you can visit your loved one. There might be restrictions in most nursing homes on how many people can visit at the same time. But yes, you're allowed. And depending on how COVID progresses, there might be more restrictions, but we can't say that for now. But right now, as we stand, visitors are allowed with screening, of course. And if you're sick, then of course you're not allowed. Meaning the visitor is sick, then there might be restrictions. If the person who's in the nursing home is unwell, then there might be some restrictions, but there are ways to work around it as well in terms of preventing spread of any illnesses the person who's sick has in the nursing home.
Yeah, so the big piece with the visitation right now, it is quite open. All visitors do need to be double vaccinated though. So that is the big piece. And then of course, like we mentioned, that they do need to be well.
Okay, thank you. The next question is, do I talk to my doctor about long-term care or I guess the Fraser Health line?
Yeah, so I can start off with that as well. So if you have a family doctor and someone posed a question about how it's hard to find a family doctor in the community. So if you have a family doctor, definitely talk to your family doctor first, and they can do referrals as necessary. And you can always call the Fraser Health line as well, and they'll be helpful as well in terms of connecting you with the right resources. And if I can just go ahead and answer that question on the chat from Sydney McGillis, the reference to a dedicated MRP is a family physician, and what if happens if there is no family doctor? So if in the community, as I said, you don't have a family doctor, then of course talk to Fraser Health line. There are other resources in the community like the urgent primary care centers where you could go, or a walk-in clinic, and the doctors can also help you there. But once you come into the nursing homes in Fraser Northwest, you will have a dedicated MRP, means most responsible provider, and that's the family doctor. So you will have a family doctor once you are in the nursing home. So that's an advantage, I guess, if you're looking for a family doctor to be in long-term care. I'm not saying that's the only advantage, but.
So it's most so that when people move into long-term care, they don't often continue to see their family doctor. They would see one of the physicians who comes on site every 1 to 2 weeks. I think it's also, though, very important to emphasize that it's really not the community family doctors who are arranging moves to long-term care. It really all does lie within Fraser Health Home Health Services. So typically what would happen is the family doctor could do a referral to Fraser Health Home Health Services when there are care needs for personal care, when we need supports for personal care. So like getting dressed or taking a bath or supervising medications or these sorts of things. And once home health is in place, where oftentimes there's home health workers coming to someone's home, it's through your case manager, through home health, that would make the determination when someone's appropriate for long-term care. So it all lies with home health. Families can also self-refer with the patient to home health services. It doesn't have to come through a family doctor.
Okay, the next question is, how do people who pay privately and are on a list for a funded bed get to stay in the home they started with? It's difficult for families to understand how the lists work.
It is difficult for the physicians also to understand how the lists work. It's all done through Access, through Fraser Health, and they do actually make it quite clear that a private bed in a facility does not mean that the person would then go to one of the funded beds in the same facility. They are looked at as anyone would from the community when they're put forward for a bed. Previously, they were looking at the 3 top choices, and they do really try to put people in their home communities, but no, you are not guaranteed to be in the same facility.
The next question is, are most residents in long-term care vaccinated?
Yes, they are vaccinated. At the facility where I work, we have 98% uptake of vaccinations. So yes, almost all of our residents in long-term care are vaccinated. And as we say, visitors have to be double vaccinated for them to visit the residents.
In my facility, it's also 98%. So we're very fortunate in this area that our vaccine rates are very high. They're not as high in other areas in Fraser Health, but in our region of the Tri-Cities and New Westminster, the vaccination rates for residents are very high. The 3rd doses are occurring last week, this week, and next week. And the consent rates have been very high for that as well.
All right. There's another question here. Do patients get a flu shot?
Yes. So every October or every fall, when the flu shot is out, all the residents are offered flu shots. And when you get admitted, you also get, we also check if you've had pneumonia shots. And if you've not gotten, we try and give those ones as well at that time, if you'd like. So, but yes, flu shots are given.
Okay, I think we've answered that question about residents being vaccinated. The question is, are there assisted living facilities that are open to those who are wheelchair bound, but otherwise somewhat independent in ADLs, or must they reside in long-term care?
I think that this would be a question that would be more appropriate for Fraser Health. To the best of my understanding on this, they would need to be able to self-transfer. They have to be able to move back and forth on their own, even if they're in a wheelchair, to be in assisted living. If someone needs a lift to get in and out of the wheelchair safely or can't transfer on their own, then that typically that person would live in long-term care.
Okay, so the next one is off topic, but for seniors at home or assisted living, do they have to register for a third COVID vaccine?
So if you've registered for your COVID vaccines, at any point you will be recalled by the system automatically when you're due for your third dose. And just looking at the next question about the physicians, it sounds as though in the news today, unfortunately, we get our updates about things like this in the news as well, but it sounds like we'll be eligible for third doses before the end of the year.
Great. We'll give it a little bit. If anyone else had any other questions they would like to put in the chat, please feel free to do so. Here we go. What if the COVID was done by their PCN at home?
The vaccine, I presume, that is all registered within the system, so that Fraser Health would have records of that.
Michiko, I see Anne, and the last initial is F. I think she went to send a message to the group, but she sent it to me directly.
Okay.
Sorry for missing the beginning, but will you be distributing a copy of this meeting on email later?
Sure. Yes, we can send a copy of this recording later. We have everyone's email information that registered.
And then on the chat, there is another statement or a question by Sydney McGillis. The personal family experience, SR, I guess that means sister, was fully functioning until they fell and broke their hip. 95-year-old husband at home, unable to care for. She had work to do to regain her mobility, moved to an extended care where rehab to regain walking, which was fine before, was not provided, confined to bed when not in wheelchair. Ultimately, she died basically due to her belief that she was put there to die. We inquired as to bringing in an outside physiotherapist, but were told no. So my question is, if care is needed in order to support, as in this example. So my understanding is, if, let's say, you need rehab of certain degree in long-term care, there is rehab provision internally. But if you want to bring an outside physiotherapy, I can speak to my care home, but we allow that all the time if you want to pay it privately and bring a physiotherapist. I don't see a problem with that. Amber, can you talk more about that?
Yeah, both. I've seen people bring in private physiotherapy to both sites that I work at. So that typically is an option. Yeah.
The short form which was used, PCN, was that for a primary care network or was for?
Primary care nurse, I think, yeah. The community care nurses now.
Yeah, there's an interchangeable name. Sometimes they're community health nurses or primary care nurses. Give it.
And Sydney, I mean, if there is any care needs which need to be discussed, I think we have a good team in terms of the physicians and I mostly talk about my facility, but I think it's across the board as I am the lead and we talk about this all the time. If there are care needs which cannot be provided in the care home and a family wants them, then we can always talk during care conferences and out of care conferences as well. That's why we have those meetings. And it's a patient-centered care, as we mentioned in one of the slides, where what your goals of care as a patient are, or your family's goals of care are, and we work on that as long as they are achievable in a long-term care home. Those are all good questions.
There's one more question here. I live in New Westminster, but my GP is in Richmond.
Yeah, so again, if someone was to move into long-term care, almost 100% of the time they go under the care of one of the in-house doctors. So typically people are choosing, I do have people that were living in the Valley and then chose to move into a long-term care facility in the Tri-Cities to be close to family. So oftentimes it's choosing more the community, and the biggest driver for the community tends to be where their family is situated. Or friends.
All right. Thank you very much. If there is any other questions, one more here. I'm new to BC, but I'm the medical service plan now. Do long-term care homes get paid for by private insurance? Is the cost determined by your income?
Yeah, so it is determined on a sliding scale for the funded beds. I'm not sure on the details of that, but so they would determine, often looking at someone's pension, and then a portion of that is taken to a maximum amount. So it's not through private insurance, to the best of my knowledge.
So Wanda mentioned you have 4 children, but all in different communities. So the preference is where you want to live. So if you like one child better than the other, then you could choose where you want to live according to that. But yeah, the choice is basically yours. I hope, Wanda, that answers your question.
Super. Thanks so much, everyone. I just wanted to thank Dr. Jarvie and Dr. Halai for their wisdom and their presentation, and thank you for everyone for attending this session. I see that there's one more question. Maybe we'll go to Anne and then we'll conclude. And we will send this all out to everyone. So for married couples, if one needs long-term care before the other, will the second person be able to get into the same facility?
I must say that I find that Access is very good about that, I've taken care of a number of couples, but the second person still needs to be near eligible to get into long-term care. There are a couple of sites within our community, Hawthorne, Belvedere, that have an assisted living site and a long-term care. While they're 2 separate buildings, they're right on the same campus of care. So that's another option for married couples. But I find that generally they're very accommodating as best they can be for married couples.
Okay, and so Mary's last question, this will be our last question. For income, is only pension income considered, or is there assets like property owned included in income calculation?
I believe that its assets are calculated into that as well. But again, the financial piece that's a good thing to speak about with the care, like your case manager. They would be able to give you a lot of detail about that. Yeah.
Great. And feel free to reach out to the division if you have any other questions, and we can always forward them on to Fraser Health or to our Fraser Health partners to answer and to get you the information as well. At the end of this presentation, we'll be sending an email to everyone who did provide their email address, and you'll get a quick survey link and some overview of some of the resources that were discussed tonight. So we would really appreciate it if you could take a few moments to complete the survey. It also allows us to understand what was successful and what we could work on for future sessions. And as I said, if there's any other questions, feel free to send us an email, and it'll be provided below in the Zoom chat box. So if we don't get any of those questions answered right now, we'll pass them on and be able to get them to you. So thank you once again to Dr. Jarvie and Dr. Halley for their time, and thank you all for joining us this evening. Have a great evening. Thank you.